I still work part-time in the ER. The ER, you'll see a 4-day-old next to a 104-year-old. I mean, the life, the variety of life, the variety of people's experience. And I don't mean it to sound crass, but it's like a series of really loving one-night stands. I've been using ketamine in the ER since 1990. But it's usually to knock people out, to relocate a dislocated hip or a shoulder, to suture up a kid. And we found that we can use it for depression, end-of-life care, suicidality. Really, it's giving you space from your end-of-life concerns, your anxiety, your depression, your PTSD, your physical pain. Wait, just to digress for a sec, we had one patient recently, and she got 3 ketamine shots. After her first one, she realized, I am lovable. After the second one, I am loved. After the third one, I am love.
Hello and welcome to the Almost Got It show. You're joined by co-founders Dylan Dane, who escaped war-torn Sri Lanka to become an MIT engineer, a YC entrepreneur with an exit to Google, and is currently CEO of System 2, a fitness coaching platform on a mission to bring personalized coaching to 1 billion people. And of course, myself, Ben Tauber, also an engineer, founder with an acquisition to Google, the former CEO of Esalen, and over the last 10 years, CEO coach to many startup founders. The two of us believe that we're living through one of the most important moments in human history, and we're about to hit God mode, where AI, longevity research, and consciousness tech are converging to give us what were previously thought to be godlike capabilities. We both personally transformed from being shy and anxious kids to successful founders and have really learned that personal evolution is how you thrive in a world with exponential change. To help us make sense of this, every week we bring on scientists, builders, and visionaries that are pushing human potential. And together we go deep on what their breakthroughs mean for how you live, work, and evolve as a human being. We're delighted to welcome on the show today Dr. David Dansky, a physician specializing in emergency and internal medicine. He has a distinguished 4-decade career. He studied at UCSF, and we're going to get into a lot of his experience in the emergency room, but also he's become a pioneer in the application of ketamine therapy. And we're going to talk about how his practice has expanded to include these integrative approaches, the impact on our psychology, the impact as we confront death. And he's been administering ketamine at the Monterey Integrated Therapies in Carmel, California. He's also a sought-after speaker and lecturer on the potential of ketamine therapy, and we'll also explore how he bridges the gap between traditional medicine and the emerging therapeutic techniques. So David, it's so great to be here with you today. And we just want to start with just, how's it going? How are you doing?
Honestly, I'm having a blast. I still work part-time in the ER. And, the ER, you'll see a 4-day-old next to a 104-year-old. I mean, the life, the variety of life, the variety of people's experience. And I don't mean it to sound crass, but it's like a series of really loving one-night stands because you dive into people's lives. I mean, that makes it sound crass, but it really is. It's that intense because, you think that, what's it like to make a friend? You meet at a party, you go out for coffee, and it takes 3 or 4 months before you really start talking about, here's what's happening in my marriage, what's happening in yours, and all that stuff. In the ER, 30 seconds.
How many married 4-year-olds are you running into, Rare?
It's the latest phase. I'm surprised you didn't hear about it.
Kids these days are sure maturing quickly.
Well, they're just blowing through kindergarten and moving on. When and you've been talking to this couple and helping them through stuff, and then the real wife shows up and you realize you've been talking to the mistress the entire time and sparks start flying.
Oh my God.
Sounds like it's out of reality TV, but this is reality. So,
yeah. I mean, it's true, right? You just you work in ER and people just get sick and run into ER and they're not planning what story to tell or whatever, right? It's just all kinds of situations.
Yeah, and people.
Oh my God!
Please help me, whatever it is.
Do you work in ER because you're an adrenaline junkie, David?
Really, it's kind of the opposite. I love hanging with people. And it's just a great spontaneous way to do it. I use the same stupid dad jokes with almost everybody. If I ask them if they want water, I'll say, would you like it with ice? They say, sure. I said, shaken or stirred. Or if I tell them they need a CAT scan, did you come prepared for a CAT scan? They'll say, well, what do I need to prepare? Well, Did you bring a cat? And then I look at exasperated, turn to my scribe and say, could you please call the SPCA, tell them it's urgent. It's just the same stupid joke that I've told 5,000 times. My scribe rolls are, we had these 20 and 25-year-old scribes. They always roll their eyes. And my kids would treat me even worse, but it just makes it more fun and playful. The ER is not inherently a playful place, and people come in with the lowest of expectations. I have horrible abdominal pain. Please don't kill me. Please don't give me the wrong drug. And, all you have to do is make it a little more fun for them. And it just really lightens the load.
So that's David's Wednesday. How about you, Dylan?
Amazing. I'm nothing nearly as exciting, I'm good though. I'm good. I have some amount of FOMO about like David's job now, but I don't have anyone just like
is
coming to me.
Doesn't have as many one night stands, or
yeah, exactly.
Becca's gonna kill me.
Yeah.
Well, and for myself, I want to thank you and Upeka for this pendant for the birthday gift.
Can I see?
Oh
Yeah. So here you go.
Beautiful.
Little
what type of metal
silver
is
and
it?
black pendant with a nice rock in there.
Beautiful.
So much appreciated. And I had something happen yesterday evening that I thought might set the tone a little bit for our conversation, because we're going to be talking a bit about consciousness. And so I have David, I have a 5.5-year-old son, and I love him to death.
Mm-hmm.
And one of my favorite things about him is just how curious he is about the world. And the way I think about it is like, here's just this mind, this conscious awareness that is trying to just understand what the heck is even going on. Right. And it goes about it in a few different ways. And so we're going to bed last night, and we're snuggling after reading a book. And he points at this painting that I have on the wall next to the bed. And it's a simple picture. You can imagine it's a flower pot, like a vase. And then it's got a few sunflowers in it, and it's set on a table. And he points at it and he goes, why is it like this? Why is it vertical, but it's flat? It looks flat. And we spent a while going back and forth, because he doesn't yet have the language to describe it. But I was like, well, what do you mean by flat? And he's like, and then we got to, it looks like it's going into the wall. He's like, well, I know the picture is flat, but it looks like it's going in the wall. And I realized in that moment, his brain had figured out perspective.
Yeah.
Right. And just like seeing that click on in that instant, right? This moment, this aha moment, and realizing for the first time that the picture was flat, but it looked three-dimensional. And so we had this whole conversation about depth of field and how things that look far get smaller, and his little brain just exploded trying to figure this out. And it's so fascinating, and to watch that happen, and the rate of acceleration of the human mind. So just want to share that.
That is actually incredibly cool, because you wonder, when did that stop? We heard Michael Pollan speak in the city about a month ago with Gould Dolan. And one of the things he mentioned, that, the reason the dinner party that got him to write How to Change Your Mind was in Berkeley about 10 years ago. And there was an older woman there, maybe late 50s, early 60s, talking about her work with young kids, 4 and 5 years old. And she then said that she had dropped acid. And he thought she was going to say 40 years ago in college. And she said last week. And what she noticed in dropping acid is that she understood how her kids thought in class. They still have that wonderment that psychedelics give you. And she says, oh my God, I never realized that all my children are low-level tripping all the time. Think back to when we were 4 and 5 years old, the world was just wonder. We wondered about stuff all the time. And, why does she say that? And what does that mean? I remember my father telling someone else, tell me the truth. And I just remember playing with that word, truth. It was such a strange word. I had no idea at the time what it meant, but it was a mystery. It was one of these curious things to wonder about. And somehow we lost that.
Yeah.
Joseph.
Yeah, I mean, isn't the default mode network that gets quietened down when you take psychedelics, and this has not developed in children until like a certain age, right? So like there's like it's almost literally true. There's some kind of children might be tripping. I remember something like this.
Yeah, I mean, it made, but you somehow, you initially you start off with a good deal less chatter,
Right.
and that really picks up. Houston Smith pointed out this, the side by side. I don't know if you remember Life magazine was huge, really, really tall, large format. And there were two side by side photographs. One was of kids playing in a sandbox. And the one right next to it was of people in a city looking up in horror. And it looked like they must have been looking at King Kong devour Fay Ray at the top of the Empire State Building. It was rush hour in Manhattan in the 1950s, and they were just waiting for Don't Walk to turn to walk. So you've got these two juxtaposed photographs, kids playing with marbles on the left and these adults looking horrified on the right. And the caption is, what happened? How do we get from the wonderment of your little boy to what we take for as common everyday reality now? We lost something along the way. What's your boy's name?
Yeah, Killian.
Killian, what a great name.
Killian.
Wow.
Yeah. Well, and so to me, that might be a great question. So when did you lose your wonderment?
I switching from religious studies in college to doing medicine, that was a tremendous loss because it's tons of memorization and there's no fun. There's no time to play. There's no time for meditation. And the wonderment begins to disappear. And then as you get into it, of course, the wonderment starts to come back. Because
what was your path to getting into medicine, David? I know that you didn't start out wanting to become a physician, if I remember correctly. I'm just curious, like when did you? What did you imagine you would become when you were a child? And then what was that path?
Either a chemist or a physician. And then I went to college and, psychobiology, which was what neuroscience would be today.
Right. Okay.
Santa Cruz 50 years ago. And then just got burned out on all the science. It wasn't, it wasn't presented in as alive a format as what we have now. I mean, now you can sit down with Perplexity or chat and just say, tell me about this, and it'll challenge you and you can challenge it. It was different back then. It was a lot, you had to go find textbooks and articles, and they'd frequently be ripped out by the previous person who didn't want you to pass the test. And, it was just much more of a hassle. And so I eventually burned out, found my way through comparative literature, went to Europe, met some really cool Tibetan Buddhists there. Started studying Tibetan and Tibetan Buddhism.
Wait, let's slow down this a little bit. This is a really interesting story. So you start with, okay, let's even before undergrad. Like, so you grew up in a family of physicians?
I grew up, my whole family is psychoanalytic. And
okay.
So when my father died, my mother, she was a nurse, not a doctor, and it was illegal. You could not become a Freudian psychoanalyst in this country.
What is a psychoanalyst for the audience?
Someone who takes a really deep dive into what makes us work psychologically. Okay. So It's not just mindfulness. I mean, not that mindfulness can't be powerful, but it's truly understanding the dynamics that make you tick, and when things go awry, where those dynamics come in.
And then are you treating patients as a psychoanalyst, or is it more like a research role?
It's a great question, because Freud wasn't quite sure that we'd ever be able to use it, but he started to use it to try. They called one of his patients called it the talking cure, because nobody had ever tried that before. Well, there were some others too, Carl Jung, William Breuer, but they were they were the psychonauts of their day, really. I mean, what they did was outlandish. Imagine that you're the only person who thinks on the planet that there is an unconscious. Imagine if you were the only one. How would you bring it out to the human race in such a way that you wouldn't be laughed off the stage? He did get laughed off the stage.
Yeah.
You know?
How did it shape you to grow up with the I don't know, like a group of adults who are psychoanalysts? I'm sure the dinner table conversations were quite different, maybe.
Well, there was tremendous confidentiality about patients. Nobody, with physicians, we talk about, oh my God, I had this guy with, aortic dissection yesterday. And, you get into as long as you don't reveal the patient's name, it's fine. With these folks, they would hardly reveal any details at all. It was incredibly confidential because there's such a pact of trust. But honestly, my mother could be so gentle. And, you get up at 3:00 in the morning to go use the bathroom. You're 14 years old. And there she is on the one family phone, very gently talking down a 16-year-old who's going through a really bad acid trip. It was the 1970s, and just very soft, very gentle, giving her plenty of space. And so what I learned was to be responsive to people instead of reactive. Instead of, immediately calling people out on stuff, you call people in. And it's a really lovely way of being, because most of us have stories. And usually when we lash out at each other, it's because something got triggered that we're not even aware of. To dive into neuroscience for a sec, it's backwards from the way it should be. We react in 12 to 16 milliseconds. If I hear a loud, say a 2x4 hits the ground, but I've been to Vietnam, for me, that's an RPG blast, and I'm diving under the nearest truck. And only 200 or 300 milliseconds later do I realize, oh, it was just a 2x4 at a construction site. Right. But by that point, I'm already in the mud. So it would be wonderful if we could reverse those two so that we could be responsive in 12 to 16 milliseconds and reactive in 200 to 300. But that will never happen. It's not how we're wired.
Yeah.
So, so growing up in that environment just allows me to respond more readily than react, because that's what it was.
It reminds me of a quote out of this book, Cutting for Stone. Right. Where, I think, there's a kid who's sort of studying to become a doctor, and the guy says to him, well, what's the treatment in an emergency that's administered by ear? Right. And the answer is words of comfort.
That was a beautiful.
Yeah.
It
sounds like you sort of embody that, both the words of comfort, but also humor, which is a form of comfort to dispel tension.
And it goes both ways. I remember one incredibly busy night. I would dash into this patient's room at 3 a.m, and she was, 300 or 400 pounds, had all kinds of abdominal issues. Her mesh was falling apart. And she just looked at me dreamily and said, "Hey, you." And I suddenly felt completely seen on a different level, just unconditional love. 2 seconds. And I was in a different state. It's not just me doing it for patients. It's a two-way street. We do it for each other. Ram Dass put it so well when he said, we're all just here to walk each other home. And so, you're
one of my favorite phrases.
Yeah. And so insofar as we can do that, all power to us. Yeah.
So that's beautiful. So you're growing up in a family of psychoanalysts, psychotherapists, and you're absorbing all this wisdom at a young age. And then what did you entering college? What did you study? What was your major?
I had 6 majors. It took me 8 years to get through college.
What?
But I'm
you complete all 6? Was that, or was it more of a rotation?
No, I graduated with like 240 credits instead of the 180 I needed. I was just endlessly curious. And so I wound up in religious studies because of the experiences that I'd had with the Tibetan Buddhists. And thought I would go on in Oriental languages, and then I realized.
When you went worked with the Tibetan Buddhist, was it before or after college?
It was during college. I went
during college. Okay.
Dropped out of school, and then just and taught English and skiing in France for a while.
And so I'm curious about that experience. Could you share a little bit about what was the impact of meeting the Tibetan Buddhists, and what captured your curiosity? I mean, there were so many things that you were already interested in.
Jesus put it pretty well when he said, "Lest you see miracles, you shall not believe." And so, there I was with these guys, and there were just, some of them just had a grounded otherworldliness, if I can, those are the words that come to mind right now. They were so peaceful, so calm, and yet they weren't airy-fairy. They were really grounded. And when one of them in particular came bounding into the room, I almost felt shockwaves. We wound up, I don't know how this happened, but there are 4 main sects of Tibetan Buddhism, and one of them is the Kagyu sect, which is Trungpa's sect. He was the first Tibetan to come over here. But over there, the Karmapa, the head, was doing a European tour, and he was starting off in Amsterdam. So we had just done this 6-week course in the Lake District in England, and we took the boat over to The Hague and wound up living with him and a few others in a decommissioned windmill house, with this endless little stairway going all the way up to the 7th floor. And it was an incredible gift just to be able to live with one of these master teachers. And he would give little lectures in the morning, and he would go around blessing people, just putting his hand on your forehead. And I remember him doing this to everyone one morning, and everybody just looked like a bliss ninny. And I remember standing back against the wall, not feeling anything, thinking, this is such a load of crock. God, what a bunch of dupes. And then, whoomp, it came through me. It was like, I had a delayed reaction because I was so dense at the time. But it was just like spiritual ambrosia. And I kept on having experiences like that where you just feel something that is so hard to describe, and yet it completely transforms the way you feel, just from a simple human touch. So, of course, how could I not be interested? We're starved for that in this country. Back in the 70s here, there were so many people hiring jumbo jets, chartering jumbo jets. 747s were brand new back then, and just to fly to India and go be with different gurus. Right. And a lot of sociologists wondered, what's the pull? And the pull is, my rabbi wasn't doing it for me. My friend's priest wasn't doing it for him. Of course, we're going to do something like that. You're looking for something more than what you're being given.
Well, and it's so interesting because to me, there are numerous stories of this, and yet it's something that science has really struggled to measure, right? And oftentimes we're not even asking the right questions, but just because science hasn't been able to explain what's happening, like, for example, everyone having this experience of what you called spiritual ambrosia, doesn't mean that it's not true. We just don't know how it works. I had an experience like this when I was 30. Dylan and I went out to Thailand for my 30th birthday and spent it in a forest monastery. And I remember just sitting there with them, we're all in rows sitting in a meditation posture, and the monks sitting up at the front and just sort of, relaxed with a little smile. And I just had the very distinct feeling that he was transmitting something directly into my brain, right? Like I was struggling to meditate. Back then I didn't really understand what the heck I was doing. And yet I could feel this sensation impacting my brain and my mind state. Right. And then fast forward some years later, I was talking with a mentor, and he did his journey to India. Right. He had been an entrepreneur, big outcome selling to Yahoo at the time, and then a big executive there. And he flew over to India. And when he got there to see the guru, he was trying to get away from technology, and he walks in there. And there's all this tech there. There's video cameras, a whole thing going on. And he goes, oh man, I don't think this is the place for me. And he goes, I need a sign. And he says at that moment, the guru, this woman, was sitting there, and she's engaged in conversation and not even looking in his direction, and picks up a pebble and throws it and hits him square between the eyes.
Perfect. Wonderful.
Needless to say, he took that as the sign.
That is wonderful.
Right. So there's so many of these stories, and yet somehow we don't know how to measure it or explain it or validate it.
It is hard, but when they are self-validating, I'll just jump to, a quick example. In the middle of flu season about 25 years ago, the ER was really busy, and this young woman, 21-year-old, came in, and she looked sick like everybody else. I really thought she had the flu. And I, made her feel more comfortable, sent her home. And I heard a voice in my left ear saying, do not send her home. Do not send her home. Do not send her home. I was a young, arrogant, brash doctor, and I just blew it off. I had no idea what this was. And I found out later, this is before cell phones, she called in a couple of days later, her family did, saying she's really not doing well. What should we do? We live down in Big Sur. They said, well, we can't diagnose over the phone. If you're worried about her, bring her back. So anyway, 4 days after I saw her, she came back nearly dead. She was in kidney failure. She had huge pyromnemonic effusions under her lungs. I mean, she was in the ICU for days. When I found out, I was horrified because I had been told, and I blew it off. Yeah. So what is the communication that I received? Why was it so accurate? And where did it come from? And these are the mysteries we get into. But, unlike the feeling that I had when my Karmapa touched me, this is corroboration. I should have paid attention to whatever the truth that voice was speaking that day, and I didn't.
Can I ask you, whose voice was it?
It was just a male voice. It wasn't one I recognized. Yeah, and I've heard it at other times too, like telling me just, to wake up before I miss a turn on the freeway, that sort of thing, in the middle of the night.
Well, because the reason I asked this is there's sort of this shared experience that most of us have as humans, right? Which is there's a voice inside our heads that's very often speaking. Sometimes it's narrating our experience. Sometimes it's thought activity or thinking through a problem, or there's mind rumination. But we don't talk about like whose voice is that? Where does it come from? And that's why I asked, because some people hear different voices. I was asking my son about this yesterday or the day before, and he says the voice is my mom's voice, which is interesting because I hear my own voice, right? And it sounds like you've got a couple different voices. Do you hear your own voice sometimes?
That's a great question. I've never really thought about which voice it is, because I think when I did my first ketamine journey, I sensed this being standing next to me, and it was a slightly different voice, and he just reached in and pulled out all kinds of mucoid lop, and just asked, "Would you like to look at this?" As casually as, "Can I pour you another cup of tea?" And I kind of nodded, and 60 years of grief over my father's death and guilt just, boom, disappeared. But that was a slightly different voice, I think, than the ones I've been hearing.
Yeah. What this makes me think about is like, it's not just probable, but even likely that the brain is home to multiple consciousnesses, right? In some senses, and the kind of the latest version of kind of how the self is constructed is generally described as like kind of there might be like 7 people in there, and just like you're the interpreter type thing. And then there are like stories of we've actually in this podcast talked about tapas in the past. I think maybe I talked to you about this, David, as well separately, where there's this practice of developing a consciousness intentionally through kind of imagining a friend and nurturing that relationship for many, many years. And again, it's actually a tradition that started in Tibetan Buddhism, but has been practiced across the world. And the fascinating thing is it seemed like you can eventually create a conscious being that coexists in your brain, and then you can talk to and just like literally, like it's not like an imaginary friend anymore, and it's just like a fully complete, so to speak, conscious entity. So yeah, there's so many ways that the voices that people hear can come to being, even within the brain.
But then it's annoying because then it has its own needs. It also has to go to therapy.
Well, like all the I think what I've read about tapas is that it tends to be a very helpful voice, a friendly voice that just like tends to kind of help you out with life and stuff. And this is something that people can do if they want to. Like, it just takes years of time. So
Yeah.
It sounds
I mean,
like it
I'm
could be a
teasing
guide.
about that, but
Yeah, no, I actually love your teas. I think it's great, but it sounds like it could be what we might call a guide in some way, or somewhere between a friend and a guide.
yeah.
yeah.
Well, and it's interesting because there's a way that we can both look at this as, I mean, if someone has multiple personalities, we say, oh, you have got multiple personality disorder. And yet there's a whole rising field of therapy around internal family systems, which allows us to personify these different aspects of ourselves and even have an internal debate, which is something that's happening anyway. If you've ever felt conflicted, you go, well, part of me wants to go on the trip and part of me thinks I should stay home and get my work done. Well, there's, you have this conflicting internal parts of yourself. And almost a question of semantics of how are you defining that? Is that part of one consciousness, or are those separate consciousnesses having a debate?
Right. And sorry, I just wanted to what you said, David, a friend and a guide. I think that's really relevant, because even if you imagine just talking to a friend, right? Like, you're stressed out about work, your relationship, or whatever. You pick up the phone, you talk to your friend, and oftentimes when you talk to someone else, they're able to kind of give you really good advice that are like kind of all kind of just like really resonate with you, right? And people have a lot more trouble kind of sorting out their own shit, but like when you're talking to someone else, it's just like you actually have like really good advice. And so then, like, if it is possible to have a consciousness within your brain, maybe it's just like that, right? Like, maybe this entity can, just like your best friend can just knows everything about you, but like not attached to your shit, so you can actually give you really good advice. So maybe this is how this whole thing plays out.
I've seen one person flip through multiple personalities in the ER, and I was getting her ready for ketamine, actually, because I was thinking ketamine might help her, and I just did a brain tap, which is something that affects brain waves, and she started going through multiple different little girls, all around pretty severe sexual abuse. And everybody was terrified. Everything was, please don't hurt me, please don't touch me, that sort of thing. And then she came back again about a year later, and she had done some work, and she'd been using ketamine. And this time it was coming out with anger. Like, don't you dare come near me. I mean, really fighting them off. And the transformation in 1 year had been profound. The question you're raising is that kind of on the same wavelength or on the same spectrum as IFS? And that's really interesting, how severely damaged these parts are. In other words, where's the difference between simple therapy with IFS and something like DID, dissociative identity disorder? Yeah.
Now, one question just to unpack that is, wouldn't DID, as you call it, be contraindicated, or ketamine be contraindicated for DID? I mean, it seems like the conventional wisdom is most psychedelics should not be used with people with personality disorders.
That's what I thought too. And there's still a lot of concern. What worked for this woman was love. I've been incredibly supportive to her. She's got a phenomenal chiropractor, really a wonderful husband, a really great therapist. All men, as it turns out. I mean, her husband's not surprising, but all the rest of us are men. And it's just really worked for her to have this much support. So I think in and of itself, if she were just doing ketamine alone with no support system, I think it could be dangerous. But in her case, going very, very slowly with just a lozenge or two, it's actually helped. And it kind of turned my head around about the possibilities of what ketamine can do with the right support.
We should really get into kind of talking about ketamine. Maybe we should talk about like how you arrived upon ketamine as a as the treatment protocol for a lot of ailments that you were observing, I assume you're a pioneer in really using ketamine for treating certain conditions in an actual clinical setting. Was it just like, were you kind of doing your thing in as an emergency room doctor, and you noticed that this can be used for beyond just like as an anesthetic, or like were you already looking for tools to treat psychiatric conditions? Like, how did you arrive upon ketamine?
There are certain things we don't have a lot of good treatments for. And a friend, I've been using ketamine in the ER since 1990, but it's usually to knock people out, to relocate a dislocated hip or a shoulder, to suture up a kid with a bad laceration. And it was wonderful for that. But I used to look at their darting eyes and wonder what's going on in there, but you have no idea.
Darting eyes, as in, so that you're seeing rapid eye movements.
Right. They get your eyes
they're under ketamine,
which is one of the reasons that, your vision is so blurry when you come out. But a friend of mine who was a therapist started taking me out to lunch because she was wanting to get me to give ketamine to one of her patients who was really suicidal. Ketamine is really good for suicidal ideation. And said, sure, I can do it tomorrow. She said, no, not that dose of ketamine. Go take this course. And I was interested. So I took this course and on how to use it just for depression and anxiety, much lower dose. And came back Sunday evening, went to work with her Monday morning, and we started working with different people. And then I started working on my own, and my wife, Mars, joined me. And she has no real medical training or psychological training. She's a pretty staunch Buddhist, so she has that, but she just turned out to be a natural. And we found that we can use it for depression, end-of-life care, suicidality. Really, it's unfortunate that it's called the dissociative anesthetic, because people are aware of that. And when I talk to folks about why they might find it interesting, they'll say, Doc, I dissociate every time I see my ex at Trader Joe's. Why on earth would I want a dissociative anesthetic? They say, what you're dissociating from is really the space. In other words, it's giving you space from your end-of-life concerns, your anxiety, your depression, your PTSD, your physical pain. And the first time I used it myself, I had a dental surgery go wrong. I realized, wow, I'm here and my pain is out there. It's not, I'm aware that it's there. It's just not mine. And that in itself is a multi-hour conversation of what mind versus not mind means. If you think about it, self and not self. But it feels like I'm in multiplex 1 watching A Complete Unknown, and it's in multiplex 7 watching Rambo 3. I know that it's there. It's just not mine. And so what my patients tell me is, oh my God, I've got fibromyalgia and my pain is across the room from me. Instead of being a monkey on my back, it's across the room and I can talk with it now. And then you just learn how to work with it, just knowing that they can be out of pain at a certain time. People who are in pain 24/7, knowing, okay, I need to pick up the kids from school. No, I need to take Billy to his piano lesson. But after that, I can come home and take 3 lozenges and I will be out of pain for this number of hours, or I can actually sleep through the night without tossing and turning because of the pain.
What's the mechanism of action with ketamine, David? I know you've talked about, like, even as an anesthetic, it's quite unique. I'm just curious your take on that.
It hits 30 different receptors. So they call it a dirty drug. They call it a promiscuous drug. One of the big ones is that it hits the NMDA receptor and inhibits that. And as a result, there's a flood of glutamate, which ordinarily doesn't hit certain pathways like the AMPA pathway, but it does. And as such, if you can, putting it really simply, if you can imagine that there's a Chicken Little network in the brain. Oh my God, the sky is falling, climb under a rock, don't make any friends, never fall in love, and you'll be safe. That kind of thing. We all have that. Again, that's that 12 to 16 nanosecond, in a millisecond freak out. And it puts that to sleep. And all of a sudden, the rest of your brain can breathe. The fact, think of how long it takes Prozac to work, or Paxil, or Lexapro, or any of these. It takes weeks before you really see a change. And I was on my way to treat a 75-year-old nurse. This was during COVID, so we did things at home. I was driving up to Aptos to see her, and another friend of mine who was an addiction specialist was coming down to meet us. And this poor woman had been through all kinds of abuse through her life. Of course, she went into nursing to take care of others, and then pediatric nursing, and then pediatric oncology, and finally, palliative care and hospice nursing, endlessly doing more and more. And she was calling us on the phone as I drove up saying, I am a nurse. I've got a stethoscope and I have blood pressure cuffs, so you don't need to bring yours if you don't want to. And I have coffee and tea and scones for you, but I realize I only have cow's milk. So if you're allergic and you need oat milk or goat milk or something like that, I can run out and get, really taking care of us when we were going to take care of her. It's just an endless need to. And we got there, and she's a nurse. I mean, if nurses are, nurses have a lot of amazing skills, but they can certainly get people and kids to take their medications. All she has to do is suck on this ketamine lozenge for 15 minutes. 4 minutes, she swallows it. And I think, I can't believe she did that. That's 4 minutes of my life I'll never get back, just in a foul mood. And I start rummaging around in my briefcase for another lozenge. And 1 minute later, just 5 minutes into the whole process, she suddenly looks up and says, "Oh, I want to live here." It's like the register of her voice even dropped. And she has been there ever since. She does a couple lozenges twice a week. And everybody, we had some friends in common. I don't know her personally, but everybody tells me she got a spine. She's no mamby-pamby with her boyfriend any longer. She will now stick up for what she wants. And she's become a person that she never was before in her 70s. And she had decades of therapy. 5 minutes. And so when you see something like that, it almost looks like magic.
So a couple of questions, because I really want to unpack this with you. There's so much there. One is just one of the challenges of describing psychedelics is what is the metaphor for it? And so I'm curious, with ketamine, is there a metaphor that you like to use to sort of explain the effects of it simply?
Yeah. So this has been asked at least since 1799, when Humphrey Davy discovered nitrous oxide, laughing gas, and in breath work, and people had no description for it. And we get the question a lot, how does it work? And we say it's a snow globe. Imagine shaking up all of your circuitry like a snow globe so that for a while nothing will seem real. And then when it all settles back down, all those grooves and ruts that you've fallen into are gone. You've got fresh snow. And people relate to that. It's more of an emotional appeal, obviously, than the neuroscience. But the neuroscience is really still being worked out. And for example, what works for pain seems to be a bunch of different pathways that aren't necessarily important for depression.
Yeah. Now, the next question I have is it's sort of interesting where you're, on the one hand, you're going, well, 5 minutes, she was changed forever. And then I also heard you say, well, and she just does, 2 lozenges once a week. And so there's this way that it sounds like she needs to sustain taking this. It's not a one and done. So maybe you could share a little bit about, what would it look like if she stopped, or what do you see in people once they roll off? Is there a reversion back to the mean, or what happens?
Usually, one of the biggest criticisms of ketamine is that it doesn't last that long. There are some studies, really funny studies actually, used with addiction, in which this Russian researcher who now works here, Krupitsky, would give a pretty good dose of ketamine, like 2 milligrams per kilogram, to someone who had just gotten off heroin, and then check them, say, a year later, and just compare that with, say, 0.2 milligrams per kilogram and show dramatic effects even a year or two later. It's so there can be some effects longer, but for most of us, ketamine seems to work in terms of synaptogenesis over 3 or 4 days. That's when we see the higher doses of brain-derived neurotrophic factor, BDNF, VEGF, as a vasoepithelial growth factor, at work creating these new. And so it's very much like doing a workout. If I work out on Monday, I'll feel great till about Thursday or Friday, and then I'll start feeling flabby again. So I need to keep that. It's unfortunate. Psilocybin, for example, might last months.
Yeah. And so just to unpack some of the terminology for some of our audience, I mean, it's what you're saying is that there's new connections being formed, right? That's the neuroplasticity, right? That's commonly talked about, where neurons make new connections so they can fire in new ways and new patterns. Is that?
Yeah. And so just to put it in really pragmatic terms, one of our patients is a 40-ish mom who came back with her 6-year-old son from the beach. He flipped off a flip-flop. It nearly hit her. And she said, "Don't flip your flip-flops off at me." He did it again, and it hit her in the face. And she went over, whacked him across the belly, and sent him crying and screaming to his room. And she thought afterwards, sending him to his room was okay. Whacking him like that was not. A few months later, having done ketamine, the same thing happened. And she looked at him and said, "It's time for you to go to your room." That's what the synaptogenesis did for her. And it's just a really practical example. You can go from reactive to responsive.
Yeah. And so do you have some thoughts on how that happens? Because to me, like, this is, you're touching on what I feel is one of the greatest challenges in therapy. Is like, I feel like so many of us are smart. We're quick to know that we shouldn't hit someone, right? And yet there's that inability to make that transition in sort of our default behaviors. What's making the difference there?
I guess what you're asking is, why would we use these new synapses rather than the old patterns we're used to? And it's a really great question, why we would make that, why our brain...
Is that what's happening? Is that the ketamine causes a new default pathway, the different set of synapses fire, and you don't hit someone?
That's what we think is happening. But then you think, someone who has a profound realization with meditation and is a completely different person, how could so much happen so immediately? Even this woman that I just mentioned, what happened in 5 minutes to transform her like that? And so, because we're human and we feel more comfortable having understandable answers, we'll grasp at something. Synaptogenesis sounds good. I think there's probably more to it.
Yeah. Now, while we're on it, I also want to learn more about sort of some of the dark side of ketamine, because one of the things that we're seeing as ketamine becomes more and more available and more readily available for at-home sort of self-treatment applications is abuse, right? It can be very addictive. I've spoken with my doctor about how he's seen patients where they've taken too much and then have been 5150'd, right? Needing to be under close medical supervision and going into different forms of psychosis. So I'm curious, what have you seen there? How, what's to be worried about?
So ketamine addiction is, ketamine hit Vietnam in 1970 in terms of what we were using it. FDA approved in 1970. And by mid-70s, it was already a party drug. And it's just grown from there. What's amazing about ketamine is that it is so forgiving in a way. You can take massive amounts, 1.5 grams in an evening, snorted. And you're in class the next day, or you're at your job the next day. We don't have... Fentanyl would not do that. MDMA would not do that. LSD would be a little much. I guess you could, but I'm thinking of Ram Dass's guru. So one of you can make it a criticism of ketamine that it is so forgiving. You look at someone like Matthew Perry, who's a perfect example of someone who never should have been given ketamine. The poor guy, brilliant actor, but he was an incredibly severely addicted personality. And so any practitioner would look at that as a red flag. Now, obviously, people at a party aren't going to bother with red flags. You want a line of ketamine, here you go. And so what we're facing is this pretty severe outbreak, especially in the UK, for a couple of decades now, and Hong Kong. And it was so bad in China that China fought hard to make it illegal and just completely take it off the market like heroin. But it is such a handy drug as an anesthetic out in the wilderness. If you were, in the unlikely scenario that you and I were both 19-year-old buddies in a foxhole in Vietnam in 1970, and I got shot, you'd pull out a syringe of this stuff, put me out of my misery, and get me medevaced out. It works in 5 minutes. So it has so many great or potentially useful characteristics that it makes it hard. I guess what we look as we try to help people with their ketamine addiction, which is psychological, not so much physical, and get people. And we have no obvious treatment specifically. It's not like there's one particular therapy or one particular drug that's phenomenal. It's not like we have a Suboxone for ketamine. But as a practitioner who is prescribing more and more ketamine, what I wonder about is how many addicts am I creating? How many people am I getting addicted by prescribing it for them? And we don't have an answer for that. We can look at the opiate data. For example, in the early part of the century, we were all saying, oh, pain is a vital sign. People need more OxyContin, MS content, that sort of thing. Chronic pain affects 20% of people in this country. It's a huge amount of people. And so what we found is that as we prescribed more of this, of course, people got more addicted to opiates. Physicians backed off, but even though we backed off, the opiate addiction took off. And so is what we're doing with ketamine kind of the same, where largely what we're doing is medically supervised, safe. Yeah, there'll be some diversion. If I'm prescribing it for a woman, she'll probably share a lozenge or two with her husband or a friend. You try to prevent that, but you know what's going to happen. What we don't want, of course, is to create dependency and addiction. Yeah. And so from our standpoint, we're trying to do everything we can to avoid that. And we work with pharmacies that, let us know, hey, so-and-so is coming in for an early refill. Is this okay? And what I found useful is just to work with people directly. We've had 2 addicts in our practice. Both of them were addicted to ketamine before they came to us. They just didn't tell us. They were just looking for, one guy wanted his parents to buy it for him, figuring this would be an easy way, stuff like that. But
how do you identify that? Because one of the things that, and maybe this is true of all addiction, I'm not an addiction specialist, but one of the things that I've heard is pernicious about this is it's really difficult to sort of self-identify what how much you're actually using, that there's ways that you can even sort of lie to yourself about your usage.
People lie to themselves, and addiction to heroin, addiction to cocaine, addiction to nicotine, you could quit it entirely and you'd probably be a better person for it. Let me give you an example of where ketamine gets complicated. We had one guy, most people come to see us for their first IM session, anxious. This guy came in looking great. It took us about 2 minutes to realize he had just driven down from Santa Cruz, 50 miles, on ketamine. He was on ketamine around the clock. And he was just coming in for an IM ketamine session to top off where he already was. So
how did you, I'm curious, how did you identify that?
Because he just looked so good. He looked the way people look when they're having a really good ketamine journey. And he was just using nasal ketamine throughout the day. Now, I talked with his therapist. His therapist said, he's been doing so well for the past year that we were going to stop therapy. It looked like he'd, really done well with it and really didn't need therapy anymore. Now I realize I have not seen him off ketamine in over a year. I talked with his wife. He said, oh my God, he's a much better husband on ketamine. He's so great with our 6-year-old. And you know what? He's a contractor. He's got a huge staff of all these workers and so on. And he used to scream and yell at them. And now he's just been treating them so well. He's getting the jobs done better. The customers are happier. So here's a guy for whom ketamine is totally functional. And he's taking it around the clock.
Right.
And I do some lab tests on him. There's nothing physiologically wrong with him. Now what? And so I had to say, well, what is the definition of addiction? Presumably it's something where you do it so much that it's bad for you and or bad for those around you, an alcoholic, for example. And here's someone where by all external parameters, everything is going well. With a couple of exceptions. I had to say, look, do you ever drive on ketamine? He said, of course I drive on ketamine all the time. I said, with your 6-year-old daughter in the backseat? He said, sure. He said, this is something you have to stop. And I worked with him for a few months really cutting back on his prescription, trying to use other things. And finally, he just called me up and said, this is, ketamine is God's greatest gift to people kind, and I cannot do it any longer. And he just quit. And, as far as I know, he has completely quit, from what I hear and checking there's a special way of seeing if he's getting it from anyone else. And unless he's getting it on the street, he's quit. I suppose that's a possibility. But he was a really good example of how good it can make your life, even though you're an addict. So, it's a really awkward situation.
So should ketamine be treated like coffee? I mean, everyone's addicted to coffee.
Well, we certainly need more controls than that, because ketamine can also flip people out. We've had a couple of people flip into mania. And had we known they had mania, this is one of the interesting things of switching over from paper charts to electronic health records. Some things get left out and you can't research it. You don't have access to those charts from 20 years ago. And if the patient doesn't tell you and the family doesn't tell you, you find out by giving them ketamine. It's
mania, meaning bipolar. Yeah.
Bipolar type 1. Yeah. Where they flip into mania.
So that mood disorder is specifically contraindicated for
pretty much. I mean, once I wouldn't do this because I'm not a psychiatrist, but a psychiatrist skilled with bipolar could get someone really well controlled with their bipolar type 1 mania, get them on a mood stabilizer, maybe start them on lithium, maybe an antidepressant, and then gently bring in ketamine. It's not like you can never say no to ketamine, or you have to never say no. Have to always say no. I forget what it is. But anyway, it's more that you want to make sure that you're not destabilizing them. And, people on their way to mania can be fun. One of my patients called me and he had just taken his first dose the night before, just a lozenge. And he caught me when I was breathing hard on a bicycle ride. And I was panting when I answered the phone. And he said, "Oh, Dr. Dansky, I know you've been snorting that Coke again." And it was funny. But it was also ominous because I knew he was one step away from mania. Because before that, he'd been horribly depressed. And he was being funny and giddy and, oh shit, he's about to have a manic breakdown. And sure enough, he was hospitalized the next day.
And I'm curious, just in that situation, when you see that, how do you work with that? Is there any way to prevent someone from having a manic breakdown?
And it's all by history. Some people will say if there's any family history of bipolar disease, I will not give them ketamine. Most of us will say, if it was well controlled in your family or just bipolar type 2, a little milder, and you've never had any person issue, let's start. We'll go very, very gently. And they've got a therapist who's watching them as well. I mean, it's a very individual thing. Which makes it hard to research because you're constantly individualizing it. It's not like giving Lipitor to 500,000 people where it's the same pill for the same type of heart disease. It makes research more difficult.
David, I'm also curious. Ketamine experience tends to vary dramatically, and therapeutic effects as well based on both dose and rate of uptake. I think I'm curious if you could talk to that effect a little bit. Like you talked about IM and lozenges, and those could feel very different. So what are the different ways of using ketamine for therapy?
One thing I want to start with is lots of people say, "Oh my gosh, ketamine sounds so interesting and I'm so depressed, but I'm just scared of using any of that shit." And these are people who've never sipped wine. They've never had a toke of cannabis. I mean, nothing. Mm-hmm. And we use ketamine cream for neuropathic pain. So I'll combine cream with bupivacaine, amitriptyline, DMSO, Neurontin, various things. And within 10 minutes, you can get phenomenal relief of, say, hand arthritis, neuropathic pain, down an arm, that sort of thing. But what I've noticed is that if people are terrified of trying ketamine, you can say, do you have a sore shoulder? Do you have a sore part of your back? How about your neck? And most people will find something and you just rub some in. And if you rub in enough, they'll get just a little hint of what ketamine can do. And you just see this look of relaxation on their face. It's like never wanted to try alcohol, but you have a quarter glass of wine. And you just get a little hint of where it can take you. So I've been using that recently just to give people a sense of where they could go with it. In terms of things.
But then if you think about it like an intramuscular injection or an IV drip, that's like a whole profound spiritual outer body experience. That's
It can
like
be, yeah.
super deep.
It can be, but before we get there, though, you can use nasal ketamine. There's one commercially made, Spravato, but you can use just in other words, ketamine is really two mirror molecules, and so they just took one of them and made Spravato. But you can also use just regular old compounded racemic ketamine, a puff or two, and it can really enhance sexual experience. You can use a little part of a lozenge, like say it's 100 milligram lozenge, use a quarter or a half for, we joke about PMS, premenstrual syndrome, but some women really suffer from what we call premenstrual dysphoric disorder, where it completely throws you off. And a quarter or half a lozenge a few times a day during those 2 weeks before you have the period can be incredibly helpful. And it can be combined with their hormonal therapy if they're doing progesterone or birth control pills. And then moving on to a higher dose lozenge, most people will find that if they suck a lozenge pretty well, and it might be 1, it might be 4 or 5, depending on if you're treating pain, you can get a pretty good experience with it. If not, you can also add grapefruit. Grapefruit or grapefruit juice blocks the metabolism of ketamine. And you need to consume it a good 4 or 5 hours beforehand. And also you need to check their medications, because if they're not on medications, it doesn't matter. But grapefruit is really the main dangerous thing that ketamine interacts with, because it can so amplify the ketamine experience and make it longer. Which can be, some people say, this is better than the intramuscular shot that I get in your office. I'm just doing 3 lozenges at home with grapefruit. But, if they're on, I'm serious, we actually are told this.
How do you dose the grapefruit?
Just either a couple glasses of grapefruit juice, or, just eat the whole grapefruit. Also pomelos, also Seville oranges, but not Valencia. So Seville oranges, think marmalade. If people are really into marmalade on their toast, look out.
Wow. And
yeah.
So you do that, and then what is the effect? Is it intensity, duration?
Both. Yeah. The intensity is not necessarily, I wouldn't call it necessarily better. I don't particularly like it because it just makes everything feel more intense, but some people really do. It's an individual thing.
All right.
Yeah. About 25-30% more intense, about 25% longer. And if you stack it, like if you do grapefruit every day, and the reason I mention this is we had one neat lady in her 50s who was on no medications, and she was having these absolutely wild journeys on just, 200 milligram lozenges. And she finally said, well, I'm doing a cleanse. I thought, of course, this is California. Of course, she's doing a cleanse. Tell us about your cleanse. Well, I start every morning with 2 large glasses of fresh squeezed grapefruit juice. And oh my God, I just love it. I thought, oh my God, that's the problem. Because once you stack it, in other words, once you do grapefruit every day, you never allow this enzyme system to recover. And so a large part, not all of it, but a large part of ketamine metabolism disappears. And
this sounds like it would be great for PMS. How kill? Right.
I'd start with a low dose lozenge first. Yeah.
Amazing.
Well, I was talking about for the man,
Yeah, no, it might well be actually, but there are just so many ways for like the folks with migraines frequently need just a nasal puff or two through the day just to deal with it. I have one infusion nurse who, she's in such pain sometimes she can't even think. Then she'll just go into the break room and take a couple puffs and she's good.
But and when you say migraines, is that because often people will think they have a migraine, but it's a tension headache. So is it
yeah, no, these are people who have been diagnosed by neurologists, and we get referred we get referred people as a Hail Mary. I have tried everything medical science has to offer this woman. Can you do anything? And so we're their last chance at any kind of pain relief, and so we pull out all the punches for them. Yeah,
fascinating. Now, I'm curious with all these incredible effects that you're seeing for patients, to hear about, for you, David, personally, how have you used ketamine in your own personal practice or your own personal growth, and what's the effect been, both positive and negative?
I'm 70. I've been doing emergency medicine for about 40 years now. Never had a problem taking care of emergencies, running codes, all that stuff. Twice this past year, I froze during a resuscitation, which is the last time, that's not the time you want to freeze. And each time it was because I saw my mother's face in the spouse of the person who was dying at the time that my father died when I was 4. And it just took me all the way back. Why it's coming up now and not 30 or 40 years, I have no idea. But I started doing, the reason I mention all this is that I realized I can't go to work like this. I either quit my job or I fix this problem. And I started doing...
Just, if I may, just to slow it down and unpack the problem. So you're in this moment, a critical moment in the ER where you have to lead your team to resuscitate someone.
Boom, boom.
Yeah, you got to go, and then you look up and you see their spouse, and suddenly you see your mother's face, and then your age regressing.
Well, I feel like I'm underwater. That when you used to say 3 or 4 feet underwater, trying to talk to your friends, who's not on the pool. Yeah, right. Just for fun. It felt like that, like I was giving nurses orders through molasses or through water.
Right.
And when I need to be really on it, it didn't affect either patient, but I realized this could be a disaster. Right. And I didn't realize I still had this issue, but I started doing a therapy called EMDR with just one lozenge of ketamine, 100 milligrams.
Yeah.
And it has been phenomenal. It's been extraordinarily, quite honestly, I get powerful messages. It's those something channels through me.
Can you explain EMDR really quickly for the audience?
Sure. There was a Francine Shapiro, was her name, who published a book called EMDR in 1995. She was walking through a forest and she was really pissed off about something. And she noticed that as her eyes darted back and forth, she started to feel much calmer about what she was so pissed off about. Talk about chance favoring the prepared mind. She went on to explore this further and developed eye movement desensitization and reprogramming. In other words, you use these eye movements. It's like a way of somatizing whatever you're experiencing, taking it out of the realm of just talk therapy. And it's now kind of standardized either with buzzers, in which left, right, buzzers going off in your hand that the therapist controls, or you can just watch a ball going back and forth across your computer screen, or in their office. A lot of us do it by Zoom. With ketamine, if you can't really use your eyes because everything is so blurry, so we can just tap, or you can use the buzzers. It doesn't take a lot of somatic awareness. It's something we've noticed with lozenges. Just sucking on a lozenge gives you some agency over your journey, as opposed to popping a tab of acid and waiting to see what happens passively. So just that activity really seems to help. I haven't been convinced that anybody quite understands why, but it has been extraordinary.
So they don't, as far as I know, they don't understand the mechanism of action. And just for our listeners, to me, the EMDR has been one of the cornerstones of my practice. I've probably done a couple thousand hours of EMDR, and to me, it's so simple. You can sort of, you can do it yourself. I have little audio beats that makes a little ping pong noise, left ear, right ear, right ear. And once you understand the protocol, you just pick some, memory that's traumatic or triggering, and close your eyes, and you just let your brain sort of free associate and let the emotions move up and out through your body. You can move through stuff pretty quickly.
Yeah.
And just, it doesn't come back if you do it right. You can just bring the charge down to zero. So, so I'm curious, how does EMDR alone versus EMDR plus ketamine differ?
Ketamine just it just parts the veil. So if there's anything you're blocking on, it takes that aside. It's like, wrapping up that really recalcitrant part in IFS and giving it a big hug and rocking it back and forth and giving it a bottle. And we actually run a course on EMDR and ketamine, but we've done this a couple of times. We have a third one coming up in September. I had never seriously done EMDR myself, even though we're running a course on it. And it is phenomenal. And, comparing this with a background in psychoanalysis where it would take years, of 3 or 4 times a day, 3 or 4 times a week on someone's couch to get any benefit. I don't know if either of you ever saw the movie Sleeper with Woody Allen when he wakes up 200 years later and, 2175, 200 years. I'd almost be done with my analysis by now. And it was the disciple in the audience who laughed the hardest because they knew how true it was, And now with EMDR, it's just boom. I mean, it's just, it's.
So do you think this is sort of 100x or 1000x or over the traditional psychoanalysis approach in terms of the speed of progress?
It's the speed. I don't know what your experience has been, but it almost has, it has such powerful spiritual overtones for me. I mean, I get really interesting messages. One of them was, the biggest of all the gifts we gave you, the biggest mistake was language, which I thought was a fascinating message. Because, if you've ever just spent a weekend with people without talking at all, and we did this once in a Touch for Health energy workshop where you just know each other by energies, it feels so much more real than what we do with words. Words are an easy default, but they don't get us half as close. So, I mean, that's kind of a side topic, but it was just a really interesting message that came through. When you spend time in Europe, there is a sense of history that we just don't have here. History might be going back to when Friends was on TV. I mean, it's just, and when we look at the 3 major discoveries so far in humanity, we just 500 years ago or so, we thought that the sun rotated around the earth, that we were the masters of the planet, and that we were the masters of our minds. And Copernicus, on his deathbed, basically, so that he wasn't, burned at the stake, published his Revolution of the Spheres book, in which he showed, we're just the third rock from the sun in a pretty inconsequential solar system. But at least we're the masters of the planet. And then Darwin came along and published his observations in the 1860s, saying, we're just an offshoot of the apes, but at least we're masters of the mind. And then, of course, Freud and Jung came along. And so now we're at the point that at least we have ourselves. And there are all kinds of interesting ways of looking at that. When patients in the ER say, oh my God, I have pneumonia. How did I get that? And I say, well, think about it. Each of us has 39 trillion cells. We have 100 trillion microbes in our intestines. We have another trillion on our skin. We have billions more with every breath. It's much more realistic to say, you're a United Nations of you. I'm a United Nations of me. What's amazing is that we all get along. But if we really wanted to do the numbers, there's, what's the ratio between 40 and 39 trillion and 100 trillion? It's about 2.5. So there are 2.5 times as many of them as there are of us. So each of us is a United Nations of you in the United Nations of the world. And so, where are we now? You go to a Buddhist weekend workshop and they'll say, the teacher will probably say something like, if we ask you to find your left leg or your right arm, you wouldn't have too much trouble. If we ask you to point out your brain, you could pretty much point in the right direction. If we ask you to find yourself, all of a sudden, everything gets a little more interesting, because for all the PET scans and functional MRIs that we've done, no one never found a self. We have a sense of self, but it's a construct. And it doesn't even have to be there. We know in meditation, when we feel completely selfless, that construct, at least temporarily, disappears. Mm-hmm. And so given that, is this then the 4th stage following Copernicus, Darwin, and Freud, of coming to a deeper sense of who we are really?
Well, and maybe because you shared with us a little bit offline, but unpack those 3 stages and this 4th stage for our listeners.
So the first, we really thought that everything was created by God, and that God had given us this perfect solar system. Originally, Tycho Brahe thought that there were just 6 planets rotating around Earth, that because 3 plus 2 plus 1, it made the perfect holy number. And it wasn't, it was about that well thought out. Eventually, Copernicus demonstrated, no, it's 9 planets and it's rotating around the sun. It's heliocentric. And that was a huge shock because nobody wanted to know that we were that unimportant. Similarly with Darwin, and he didn't publish that. He knew about this in 1520. He didn't publish until 1540 something. He saw the first manuscript of what he'd written, published manuscript, on his deathbed. He was no fool. Darwin did the same thing. He started putting his ideas together in the 1830s and 40s after his trip on the Beagle, but he didn't publish until 20 years later, I think. It is hard to come up with these new ideas, knowing the ostracism you're going to get. His book was certainly a bestseller. He didn't have to worry about that, but there was a huge hullabaloo about it because all of a sudden it showed us we're a lot less than we thought we were. If you want to think of being masters of the planet, but at least we are masters of our minds.
Right.
And Freud came along. And, interestingly, side note, Freud was far more interested in mental telepathy than he was in the unconscious. But he couldn't talk about that because just getting the idea of the unconscious across would be hard enough. And if he entered something as, woo-woo as telepathy, he knew they'd throw the baby out with the bathwater. But he put across the idea of the unconscious. And he was not a popular speaker, but a small group of physicians and people who were interested started to meet with him in his apartment in Vienna. He would take patients on vacation with him. He had 6 kids. Imagine taking 6 kids and your wife and patients. He was one of these people who was completely into what he was doing. But after a while, people began to realize there was some reason for which people were doing these strange automatisms, especially some of the ones that we saw after World War I, where soldiers would kind of reenact what they did to someone else, like with a bayonet, or reenact something that happened to them. You'd see these traumatic reactions. And people began to realize there's something else going on here besides the conscious mind. And that's when he became increasingly popular.
And then those are the 3. What stage is that?
So that would be, we are not masters of our minds, but at least we still have myself. I still have myself, right?
So you start with the master of the universe, and then you realize that you're not the master of the universe. Maybe at least you're master of our kind of environment and on Earth, but then you're not the master of that. And then maybe at least you're the master of your mind and consciousness. And then you realize that that's not the case either. And so then where does this take us?
Yeah, and so the 4th one is there's not even a you to be a master of it.
Right.
And that's the beauty of mastery. That's the Zen experience. Zen and the art of archery. So it's, so I think we're just about there. And all of a sudden we have so many things that are helping us. Psychedelics can be incredibly helpful. Again, with the usual provisos about being done in a supportive environment and concerns watching for addiction. AI can be incredibly helpful. I don't know if you've ever asked AI to say, just ask chat, you're an ayahuasquero, take me through an ayahuasca experience. It does a very nice job. It's quite impressive. And then we have
wait, so just to pause on that one. That was an interesting statement. You have asked ChatGPT to guide you through an ayahuasca experience?
Yeah.
While you're on ayahuasca?
I did not I just wanted to see what it would do. I just tried this a couple of weeks ago, but I was impressed with how able it was. Because I said, are you going to be taking medicine with me? They said, well, yes and no. I thought that was I was impressed. And people are certainly finding it helpful with therapy.
There was some articles about how people are using ChatGPT as sitters for psychedelics. Yeah,
sitters, and it's much more. In medicine, there was a study in Austria in which they took pretty experienced ER docs And they made a diagnosis 74% of the time. ChatGPT got it 85% of the time. Then there was another study in which they had either a physician or ChatGPT respond to patients as the patients interacted with it. And then they asked all the patients, would you like to see that doctor again? 25% who had seen a human doctor wanted to return to that doctor. About 78% of the patients who talked with ChatGPT wanted to return to that doctor.
And particularly for psychotherapy, David, we had Jay Sanghamneti last week, who works with ultrasound for treating certain disorders, and a lot of this. One of the challenges has been, in that field, but in general in psychiatric fields, is the integration experience, especially if you use psychedelics and stuff like that, which seem to be really, really important. And so, how do you make it standardized and more effective? And Jay was excited about using AI to do that, and I think a lot of people are thinking about that. That's really, really interesting, right? Even for ketamine therapy, I could imagine after you take ketamine, and then like the integration could be guided and driven through ChatGPT, and that could probably enhance the effects dramatically.
I think I think you're absolutely right. And what's striking people is that they feel like that ChatGPT or one of the AI systems becomes the kind of guide. What was the name of the topple term that you used before, where that it's like a presence inside your.
Oh, tulpa,
yeah, tulpa. And so it's striking that it can be so helpful. So we have psychedelics making this whole job. Again, my initial stance is from what does psychoanalysis do? Where can psychedelics and things like EMDR take us? It's a huge leap. Where can AI take us? I use AI at 3:00 in the morning in the ER when I'm really stumped by a particular case, and it is magnificent, and it's not asleep, and it doesn't get defensive, and it doesn't mind being woken up. And, just all those advantages, and it gives me a very elegant differential diagnosis that I can put to work. So clearly it can do the same thing with this. And then, then the third part of this trinity is that people really struggle with their weight. A lot of people do. And it's always been a blame game. If you really wanted to lose weight, people in Auschwitz didn't have any trouble losing weight. You're obviously not trying hard enough. And I mean, it's just awful. And
is that the voice in your head? That's really aggressive.
No, it's just, I've actually seen this online where, it's odd. People say, I can't, even no matter how little I eat, I won't lose weight. They say, well, the people in Auschwitz didn't have any trouble. Obviously it is possible. I mean, which is a horrible thing to throw in someone's face.
Right. Yeah.
But it does happen. And I think people feel that blame game quite a lot. And all of a sudden, I mean, as I work with 40 or 50 nurses, and I can't believe the weight loss that I've seen in the past couple of years. No one's trying all that hard. It just comes up easily. And so we've got this unusual trinity.
What is it that's causing the weight loss?
GLP-1 inhibitor, GLP-1 agonists like Ozempic and Wegovy and Zepbound.
Right.
Yeah. So it's kind of a funny trinity right now of three major influences in our lives.
Yeah, and so
I'm curious, how do those connect? I sort of get the meditation and the AI or the psychedelics AI connection. I see how those relate. How does the weight loss connect with the?
What I do, weight has not been that much of an issue for me, but for those that I've seen who are like women who put on 60 pounds at childbirth and just cannot take it off, they feel completely transformed, and it's always a part of their depression. Especially in this society, more so than for men. But a lot of men would like to lose 30 or 40 pounds too. And so all of a sudden, without trying, you're not constantly depriving yourself and feeling hungry. And so it allows you just to move through this, and then you can get back to whatever you're doing with AI, whatever you're doing with psychedelics. All three make life that much more effortless.
And GLP-1s directly affect your kind of cognition as well, right? Like you actually have more executive control and you're less addictive. Maybe we should give ketamine and GLP-1 in combination with these folks.
It is a great idea. I have wondered if, not everybody is, but it would be really interesting because addiction specialists are beginning to use them more and more.
Yeah. You heard it here first. You do an muscular injection of both
at the same time. Yeah. David, a topic that we're really interested in exploring is this idea of the tremendous power and control that you have over your life these days, and you almost kind of like living a godlike existence. And I'm like the way you put it earlier, where you said humanity started out thinking you're the master. You're the master of the universe, and then like kind of your sense of like that mastery kind of dwindled to what it is today. But inversely, when we used to think we were the masters of the universe, back in the day, we actually had no mastery of the universe. Like we were suffering from everything, and we had very little control, right? Whereas today, in some ways, we're like kind of coming to terms with the fact that even our intelligence is not unique, and that's like kind of maybe the lowest level you can get to, in the sense how self-important you are. On the other hand, you have almost godlike control over everything, even your physiology and your mental state, and the tools that are becoming available are remarkable, from GLP-1s to ketamine to TMS to, I don't know, like a whole list of like AI. So there's beautiful irony there, right?
Well, it's something that Gandhi talked about. Someone asked Gandhi when he was going over to see King Edward after he was released from jail, and he was wearing his dhoti, just a half sheet on the boat. And the reporter said, "Mr. Gandhi, aren't you embarrassed to be seeing King Edward and all of his splendor and regalia?" And he said, "No, I'm sure King Edward will wear more than enough clothes for the both of us." And someone finally, someone else came over and said, "I thought, you're just so humble. I mean, it's astounding." He said, "Me? Humble? I'm the most ambitious person on the planet. I want to make myself zero."
Wow.
Yeah. I want to make myself zero. He was trying, it's the same thing, because it's the realization really that we are zero in that sense.
So a few things here. So one is, you're talking about this sort of trinity that's coming together: psychedelics, AI, weight loss, these things that typically have limited us. We're starting to transcend those. And I'm curious if you could paint us a picture of what does it look like when regular folks have access to all of these, and really play it out for us. Where does this go? What's the potential individually and collectively?
That is such a great question, because it's a conversation that folks like us and many others will be having for quite a while. But let's think about it. If people are truly able to find the help they need, not just information, but actual help they need from AI, how much will we still need each other? Will it be like adding a friend to a friendship, or will it be like replacing friends with this new friendship that you have? And probably we'll see some of both. I mean, some of it will be not so healthy.
Pretty soon, Dylan's going to replace his co-host with a tulpa.
With psychedelics, I mean, I've been in a men's group where we've done psychedelics quarterly for about 20 years, and it's really brought people together. It's been beautiful. And so, I'm thinking that will probably continue, but it is wonderful just to be, when you don't have that person you need for integration, when you're 3:00 in the morning or whatever, I could see where AI could be incredibly useful. And again, we're going to have to be very careful to approach all of this with as much love for ourselves and compassion for each other as we possibly can, because a lot of mistakes will be made. And again, it's a matter of calling each other in, not calling each other out. But I think it's really a great question. Where is all of this headed?
Another topic I wanted to touch upon with you, David, is that as an ER doctor, especially, you have particularly probably been exposed to a lot of people having near-death experiences, and you're deeply interested in consciousness. And then now we're talking about with AI and there's like a whole nother new perspective towards how the brain works and consciousness and all that stuff. How does all this stuff tied together for you? Just curious about your thoughts in that space.
So for me, it began with an experience about 30 years ago in an ER. It's 5 o'clock in the morning. Little old lady in a, lady in a nursing home was 85 years old, found dead on rounds. And so she's brought in, and the paramedics are great. They throw all kinds of things at her. She's not responding. And we have some extra tricks that we can do. And she's still not responding. And so, she's getting CPR while pushing drugs, shocking her now and then. And all of a sudden, I feel the weight of a Victorian cloak over my shoulders. That's kind of what it felt like, this 20, like to keep out the London cold in the 1850s. But with that cloak had a certain emotion to it. It felt like this old wizened joy. And it wasn't an emotion I'd ever had before, or frankly, I've ever had since. And I thought, holy shit, this must be her coming out. I've never felt anything like this. It was like someone leaning on my shoulders. I could actually feel it. And we had just pushed one last drug. And one of the techs had his fingers on her femoral pulse. And that lasted for maybe 20, 30 seconds on my shoulders. And then boom, it was gone, which really surprised me. And because I thought she was on her way out. And then 10 seconds later, the tech said, hey, I've got a pulse back. And she went to the ICU. She died the next day, never woke up. I was never able to talk with her. But after that, I started being a little more observant. And because I felt like she was just coming out to say, love you, thanks, whatever. That was the only model that I could think of that would make sense of that experience. And since then, I've checked in with people as they die. And sometimes I don't feel much of anything. Sometimes it's an emotion like one I've never had before, which is why I don't think I'm making this up. Like, hey, this is kind of nice. Like, your first really good scotch. Or just absolutely flamboyant bliss. Like I had no idea it was going to be this amazing.
So you're describing the experience of someone dying, right?
Yeah, exactly. As they
Are you saying that when you check in, they're saying this to you, or that's that you feel?
I feel it.
That?
I feel it. Yeah, I feel it. A good friend of Dylan's and mine recently died, actually, and his wife became quite concerned on the last night. And we went over there to see him, and he was thrashing around, and he was, he was quite unconscious. But we'd left some drugs in the refrigerator for just this kind of thing. And I plunged a huge dose of Ativan into his thigh. And
what is Ativan?
It's like Valium. It's like a very powerful benzodiazepine. We use it a lot, just to mellow him out.
So it's sort of a anti-anxiety.
Exactly. Yeah.
Medicine.
Yeah. Because he was going through it. And when I got back to my home later that night, I was just putting my medical supplies away. And I had this strong sense of this fellow standing next to me. And he was looking at me with this wonderful grin and said, why are you plunging syringes into corpses when everything is so beautiful? Everything is so perfect. And that was my last experience of him. I had no reason to make that up, And then similarly, back in the ER, when people have had particularly spiritual lives, they've meditated all their lives, etc., prayed, sometimes, I don't know how else to describe it, but a light and warm energy that just fills the room as they pass, just shedding that mortal coil.
David, I actually had this conversation with our friend who passed as well before he passed, where we were talking about death and how the experience of death itself has changed over time, as thanks to technology and advances in medical science. And I've read accounts of things like cancer, for example, how it was treated back in the day. And a lot of cancer patients were removed from their sort of, regular where they lived, and they were kind of enclosed in enclosed environments. And the reason was that they were going through such excruciating pain as cancer was progressing. And there wasn't a lot you could do about it. And it was just like so horrific for anyone to even witness. And it was a very, very painful way to die. And, as you know, a lot of people do die from cancer. And so that's not that uncommon. Whereas today, the the number of tools doctors have available, I mean, cancer is still horrific, but even like regardless, right? Like if you're dying, you can actually make it a quite peaceful experience, thanks to a lot of the anesthetics and stuff like that. So yeah, that's like a huge thing that we don't even think about, right? Like the amount of suffering that we've been able to remove from the experience of dying itself, and all the tools that a doctor like yourself has today at your disposal.
Yeah, I mean, we do this in the ER now. Instead of trying to save everyone when it's clear they're going to die, it's morphine and Ativan, again, the benzodiazepine,
Right.
drugs that will make them really, really comfortable. And then they can still be with their families, but
Right.
not be, and then be at peace. And then psychedelics in general, especially psilocybin, has been used in the end-of-life experience.
Right.
And ketamine is phenomenal. I mean, ketamine is actually phenomenal long before they die. When our patients come in with stage 3 or stage 4 cancer, they're petrified of death. Ketamine is the psychedelic, probably the closest to what we only have near-death experiences, of course, to compare it with. But that seems to be the closest to death because I'm still here and my body strips away. This must be death.
You're making such a good point. I was referring to the physical experience, but you're talking about the psychological pain of approaching death, and people used to be terrified of this.
Yeah.
Where you're going, what's happening, what's going to happen. And they probably lived in this agony for like months, if not years, right? Unless you're like an experienced practitioner of meditation. But today, again, physicians have tools like, ketamine to, I don't know, psilocybin and so on to give you a sense of maybe that what this is going to be like really come to terms with the idea of dying, and you could probably even psychologically approach that experience with so much more peace, and that's incredible.
I mean, let's think about the things we'd like to be on as we die. I would love to be on a little bit of ketamine, probably a little psilocybin too, maybe some 5-MeO. I'm just, I want to be with my loved ones, and
I'd like to be on some MDMA when I die.
Yeah, that would be a really good addition as well. And so, you think, and the sad thing is 3/4 of these are illegal, still, but they won't be then. But there is such a beautiful way to explore this final passage that doesn't have to be frightening at all. Yeah.
One question there is, I'm curious for yourself, if you're willing to share, just how are you preparing for your own inevitable passing?
Honestly,
or do you not consider it inevitable?
I am so looking forward. I mean, I'm not looking forward to it like I can't wait, but from what I've seen, so the standard dark humor, black humor joke in the ER is life is nothing but a sexually transmitted condition, which is uniformly fatal. And as far as we can tell, death is completely safe. So that's the joke. But in my own experience, this is what I've seen, that, but not the suicides. I mean, the room, the energy in there is really dark in the room. But when I'm taking care of people at end of life and they finally pass, it is by and large a stunningly beautiful experience. And I think this is what we're spending so much money trying to prevent. And it's just rejoining the energies. It's, right. I mean, it's so lovely.
Yeah. One quick follow-up, just pulling the thread. You said that the energy when it's a suicide is really dark. What does that mean, right? For someone who doesn't understand or hasn't heard that phrase, the energy. What's different?
So in Sanskrit, for example, we talk about chakras. And there are words like prana, or we might have chi in Chinese, or ruach in Hebrew, espiritu in Greek. We don't have anything like that in English, but we do have words that speak to it. Mojo is probably the closest that we have in terms of energy. Again, in terms of, instead of third chakra, I might say, ooh, I've got a bad gut level feeling about that. Mm-hmm. Or in my heart of hearts, I feel, or in my mind's eye, I see. We actually do have terms for energy in English. We just don't.
Yeah, or like vibes.
Yeah, exactly.
Right? It's like, oh yeah, I get good vibes from someone. So you're just talking about how you're feeling thematically.
Or people say, I have a spidey sense that something's about to go wrong. Yeah. Why spidey? What is it about a spider that's intriguing?
Yeah.
Yeah. Yeah.
And are you able to determine that even if you don't know that it was a suicide, right? Is there some way that you're able to detect that?
I mean, sometimes they'll just, it might not just suicide. Some people have had really, really rough lives.
Are we sorry, David? Were you talking about specifically people who attempt suicide and then end up in ER? Yeah. So this is actually so we've been talking for so long, but like David, you have a set of experiences that so many people would never come across. I mean, most people don't like sit next to people who are dying unless if their parents or something like that, and you get to do this. So not get to do this, but you have to do this like quite often. And then some of these cases are like people who tried attempting suicide and then didn't go well, and then now you have to deal with that. I mean, that alone is incredibly unique.
Again, I think the most useful technique is just love and acceptance. It's just because everybody feels embarrassed and, oh my God, this didn't work. I mean, they've already felt like a failure. No, I can't even get this right. And of course, they're embarrassed in front of their family and they feel horrified in front of their children. And just helping them feel, it's okay. We all have these feelings sometimes, and you decided to act on it. Let's see if we can help you get to the point where you no longer need to act on it because everybody here loves you. And it's, it takes so long for people to hear that they can be loved. Wait, just to digress for a sec, we had one patient recently, and she got 3 ketamine shots. After her first one, she realized, I am lovable. After the second one, I am loved. After the third one, I am love. And that's the trend. That's the progression that we're looking for, where people can actually feel they're lovable and there is nothing but the love they're experiencing.
Yeah, I think some of the most promising data for ketamine use in psychotherapy comes from people who are suicidal. I think something like 70% remission rate after like just one treatment.
Yeah, it was amazing. Yeah. And they didn't even, in that particular study, they didn't even have to, even if their depression didn't completely go away or wasn't that touched, in 1 hour, they were no longer suicidal. It's what sometimes I'll sneak some ketamine to a patient who's suicidal in the ER in low dose, and I see exactly that same effect. It's magnificent. And we have nothing else that'll do that,
So as we come towards the end of our podcast time here, which I'm regretting that it's over so soon, we're curious about what are you doing for yourself, right? Like what are the protocols that you're personally using? And maybe what are you, if there's something that you're excited to try next?
I've been really intrigued with 5-MeO because it is such a powerful tool, and combined with ketamine, I think it can be extremely useful. Again, 5-MeO can really, it's like driving a Ferrari, driving a race car.
Yeah. And so maybe share just a little bit about what it is and that experience. And then I'd love to hear about how you're interested in using it.
Yeah. So 5-MeO is a slang term for 5-methoxy. It's Me is methylamine, makes it an oxygen, and that's attached to DMT. DMT is the active molecule in ayahuasca. And what makes ayahuasca work is that it's combined with a secondary vine, which works like an MAO inhibitor, so that the DMT doesn't get metabolized quickly. The MAO inhibitor keeps it from being metabolized so that it lasts several hours. 5-MeO, on the other hand, is really just a version of DMT, so the experience is pretty quick. But it originally was found either in certain plants like Syrian rue, or more locally in the Sonoran Desert, in the parotid gland secretions, this gland up here, of the Sonoran toad. You wonder, how on earth did they figure this one out?
Yeah.
But
I wondered that.
Yeah, but if you freebase those secretions, this is what happens. And there's a little bit of a debate as to whether it's the entourage effect, like we see with cannabis, which is, over 500 different chemicals, phytochemicals, and you need to do the whole thing. You can't just take Marinol. And some people feel it can't just be the 5-MeO. You really need all the parotid secretions. But most of us don't want to hurt Sonoran toads, and we'd much rather just take it in pen form. And then the experience is one of suddenly being thrust into the cosmos quite abruptly. And there's virtually no sense of me, just wonderment in space. And then you gradually come down almost like a leaf, down from the stratosphere. And it's incredibly loving. It's incredibly enlivening. When I take it, though, I find myself missing the ketamine, because ketamine gives this deeper existential experience, and the combination together is like water for chocolate. I mean, they just feel like they're made for each other. I know some people are using them an IM dose of each, and that can be extremely powerful. But it's something that I'm just beginning to explore. I can't use it in my office, of course, because it's illegal, but it is quite intriguing to explore personally.
It's also known to be one of those substances that truly, truly helps you come to peace with the idea of dying.
Yeah.
And as we come to a close here, we like to ask the question that if someone listening sort of feels stuck, whether it's anxiety or lack of purpose, or maybe they're suicidal, or just feeling overwhelmed with the amount of change that's happening, and they could only implement sort of one thing from everything that we've discussed today, where would you want them to start tomorrow morning?
With love, with forgiveness, with empathy for each other. There was a beautiful little clip on YouTube of this guy who was he's a blind guy begging for money. He's got his little coffee cup out there, and the sign says, "Help, blind, please help." It's blind, please help. And he's getting an occasional quarter, not much. And all of a sudden, this woman comes up to him and grabs his sign and starts scribbling. And she's got really unusual shoes on, and he just reaches over and feels her shoes. And she leaves. And all of a sudden, with whatever she scribbled on his sign, he's getting huge amounts of money. He fills 2 or 3 coffee cups. And she comes back after a couple of hours. And he reaches over, and she's standing there. He feels those shoes. He says, it's you again. What did you do to my sign? She says, oh, I just changed the words around a little bit. And she walks off. And then they show you a picture of him with his sign. Previously, it said, blind, please help. This says, it's a beautiful day, and I can't see it. Mm-hmm. You feel the difference in that? So it's like that. If we can get out of our own way, oh my God, I've got a horrible back. Everybody hates me. Oh my God, I can't play pickleball any longer. I don't have any friends, all that stuff. And just realize that we live in a world of true beauty. Despite all the human chaos going on the planet, we live in a world of amazing beauty. We can still be those children like Killian, playing with, wondering about perspective and photographs and just the majesty of the world,
Yeah.
On that note, thank you, David. It was such a beautiful way to...
I feel like we're just getting started.
Yeah, I know. We didn't even get to a third of the questions that I had for you here. So maybe we'll have to do this some other time again.
Wonderful.
But you're one of the most generous humans that I know, and thank you for everything that you've done over 40 years for countless patients, and you've so many admirers in the world.
Well,
so
love is where all the fun is.
And
that's
thank you so much.
Right there. All right,
and
that. Thank you.
Yeah, to all of our listeners, please hit that subscribe button, like button, and let us know what we can do better, who we should interview next, and so on. And it's been a really great time.
Absolute delight. Yeah.
All right.
All right.
All right. Thank you very much.
Okay. Take care.
Great.
Bye-bye.